If you think modern medicine is scary, wait till you hear what the doctors were doing to their patients in the 1970s. The details are horrifying. Imagine trusting your doctor with your life, and in return, you find yourself being a guinea pig for the most unimaginable risks and questionable practices. Today, we will reveal 7 of the most outrageously dangerous medical practices from the 1970s, from lobotomies to thalidomide. These medical practices tell us a story about how far we have come in terms of health and safety. So keep your eyes and ears open because most of these are truly shocking. Some of these will make you even question the very ethics of medical science. Practice 1. Lobotomies, the cure for mental illness. In the 1970s, there was still little research done on mental health issues, and openly discussing them was still stigmatized. So don't be too surprised if I told you that if you were depressed, anxious, or having an even more complex mental health issue like schizophrenia, your doctor would definitely suggest you go for a lobotomy. To give you a heads up, a lobotomy is a surgical procedure that involves outright destroying or severing your connections in the brain's prefrontal cortex to control your emotions. Various techniques were used, one of which was leucotomy, where specific tissues of the brain were removed. If that sounds gruesome, another was transorbital lobotomy, popularized by Dr. Walter Freeman. It was a notorious procedure in which a sharp instrument, similar to a large ice pick, was inserted through the eye socket and into the brain, moving the instrument back and forth. The frontal lobe connections were severed. During the 1970s, when the world was still progressing and working on new inventions, most of the psychiatric wards of hospitals were often filled with patients with severe mental disorders or issues. The most common treatments available were insulin coma therapy or electroconvulsive therapy, or ECT. Lobotomies were considered to be the last resort for those who were not able to get a cure from them. Some of the most commonly treated were obsessive-compulsive disorder, or OCD, severe depressive illness, psychosis, and chronic neurosis. The risks and consequences of this procedure were extremely tragic. Patients were left with permanent brain damage. Some of them lost their ability to think clearly and feel emotions, or even memory loss. The tragic and depressing example of lobotomies was Rosemary Kennedy, the sister of JFK. She was the eldest daughter of Joe and Rose Kennedy, who had an intellectual disability. At the age of 23, her father arranged a disastrous lobotomy, which left her with toddler-level mental abilities. On the other hand, some became outrageously apathetic and experienced drastic personality changes, leading to different personality disorders. Some of the major complications involved were seizures, or at worst, death. Thankfully, as we progressed and our understanding of mental health improved, better treatments were made available. Lobotomies were seen as a procedure that was severely dangerous, irreversible, and most of the time, incredibly damaging and even inhumane. The procedure lost its favor as a medical procedure and was finally phased out before the decade had ended. Practice 2. DES for pregnant women, hormone of the future. Imagine going to your gynecologist with your very pregnant body, and he gives you the miracle drug that was marketed to work as a magic potion to avoid miscarriages and complications during the 9 months of pregnancy. This magic potion was diethylstilbestrol, or DES for short. In the 1970s, it was believed to ensure healthy babies, and doctors were prescribing it to every other expecting mother. However, what was once considered to be a magic potion turned out to be the poisoned apple that was given to Snow White. DES was a synthetic form of the female hormone estrogen. In the 1970s, doctors assured mothers that this synthetic hormone would prevent miscarriages and premature births, and that it was totally safe and effective. DES was promoted by doctors and pharmaceutical companies as a miracle medication that could strengthen the uterine lining and enhance fetal health, thereby preventing pregnancy complications. Well, this really was far from what they assumed. After decades, after further advancements in the medical field were made, the reality of DES was revealed. And trust me, it was nothing like what the doctors claimed. The most startling discovery was made when DES daughters, or daughters of mothers exposed to DES, started to suffer from severe health issues. It was found that it was strongly linked with a certain cancer risk known as clear cell adenocarcinoma. It was a rare vaginal cancer that predominantly affected young women exposed to DES in utero. It caused infertility, premature births, ectopic pregnancies, and other gynecological issues. Other than that, It also leads to an increased risk of breast cancer, not only in women, but also in their daughters. When these devastating side effects were revealed and made clear, the United States Food and Drug Administration, or FDA, finally banned it in 1971. Nevertheless, it had clearly left a lasting mark on both mothers and daughters. After that, there were stricter testing and regulations for drugs, specifically given to expecting mothers to ensure the safety of both them and their babies. Practice 3. Dowkin Shield IUD. Revolutionizing birth control. Imagine a time when all you wanted was a contraception to avoid taking birth control pills, which were short-term and had adverse effects. So, you got recommended an IUD. The Dowkin Shield was introduced as a revolutionary intrauterine device, or IUD, in the 1970s. It was marketed by the A.H. Robbins Company and launched as a promise to revolutionize contraception. With this unique design, shaped like a small flexible shield, it was to be the modern solution to birth control. It promised to stay in place for years without the need for daily action like birth control pills. But like DES, it too had a lot of side effects, affecting the women and their bodies. You see, there were significant flaws in the device's design, which caused numerous complications. The Dowkin Shield was made of plastic and had 5 prongs that mimic crab claws. The copper components on top were said to make contraception more effective by acting as a spermicide. The device featured a supposedly unique tail string, which was a thread made up of multiple filaments woven together to form a string structure. This thread was left to hang from the cervix to aid in quick removal. However, you see, this string was the source of all the issues. The Dowkin Shield string was not properly sealed at the end, in contrast to other IUDs with sealed strings. The design flaw left vaginal bacteria with enough space to enter the uterus and abdominal cavity, resulting in severe infections. In the worst-case scenarios, these infections could progress to septicemia, a life-threatening blood infection. Unfortunately, some of these infections did result in women dying. The long-term consequences were evident. Thousands of women were left infertile or with some of the worst chronic conditions. Some suffered from miscarriages or premature deaths of the fetuses. Finally, the women who suffered the most took matters into their own hands and filed lawsuits against the manufacturer, A.H. Robbins Company, and the healthcare providers who were responsible for advocating for the product. In 1974, the FDA finally requested that it be outlawed. The Dowkin Shield now serves as a tangible reminder of the significance of strict safety testing and supervision, especially for devices that have an impact on patient groups that are more susceptible. Practice 4. Thalidomide, the morning sickness miracle. Just imagine you are pregnant. You're excited for the mini version of you, but you just can't catch a break from discomfort. Along with suffering from unrest and hormonal changes, you have to deal with unsettling morning sickness. Seems really problematic and not so happy at all. Well, most pregnant women suffer from morning sickness. It's like the early signs of pregnancy. In the 1970s, thalidomide was introduced as a special kind of medicine that promised to alleviate it. It was touted to be safe and effective, having zero addiction and promising to help with nausea and help you get the rest you need. It was originally developed in West Germany. By the early 1960s, it was available in more than 6 countries and continued till the 1970s. It was prescribed to thousands of pregnant women who hoped that they would have a more comfortable pregnancy with ease in the symptoms. Well, apparently, the manufacturer, Chemie Grünenthal, a German pharmaceutical company, misunderstood its side effects. The company didn't pay much attention to the testing of the drug on pregnant animals. Therefore, it was able to realize that it had the potential to cross the placental barrier and eventually affect the fetus's development. The end result? It triggered a global health crisis. A large number of children were born with severe birth defects, including phocomelia, a condition in which the child's limbs are either missing or shortened, leaving them with flipper-like arms and legs. Furthermore, many infants suffer from organ deformities, as well as hearing and vision issues. Most of them had underdeveloped organs, making their lives extremely difficult, if not impossible. In the end, it was banned in the early 1970s, but this particular scandal led to over 10,000 babies suffering, not just as infants, but also as adults. However, the ban led to multiple forms, like the Kefauver-Harris Amendment in 1962, and stricter checks and balances on drug manufacturing. The company, however, is still in business. Practice 5. Electric shock therapy for behavior correction. Most of the cures for illness in the past were more than outrageous. One example from the 1970s was electric shock therapy for almost everything. Imagine you were a teenager, a rebellious adolescent, or someone struggling with behavioral or mental health issues. One of the most known effective solutions was strapping you to a chair and electrocuting you. Shocking, right? The idea was, well, kind of out of the blue. They used to believe that these electric shocks would result in seizures, and these seizures would work like magic, somehow resetting the behavior patterns. The more bizarre fact about this practice is that it was mostly used on women. That too without their consent or any anesthesia. Specifically on those women who were deemed difficult. Husbands tended to declare their wives mad or hysterical and send them to hospitals to be electrocuted for their anxiety, depression, or even having unladylike opinions. Well, the resetting of the pattern didn't work as much as they thought it would, leaving many with consequences that were tragic and sick. Many people were left with memory loss, migraines and headaches, muscle spasms, disorientations, and even seizures. This so-called behavior correction therapy left deep scars, with thousands of individuals suffering from long-term anxiety, chronic depression, and even PTSD, or post-traumatic stress disorder. So instead of correcting, this quackery led to more issues. As social awareness about mental health issues spread, people became more concerned about the ethics of this practice. Eventually, this inhumane method was discarded, and consent protocols were introduced to protect the patient's rights. Practice 6. Mercury for skin conditions. The quick fix. The 1970s were an era when quick fixes were the go-to remedies for a variety of issues, including facial and skin conditions. Imagine you have a skin condition like, say, pimples or rashes. So your skin specialist recommends a cream that is both famous and widely used. But the catch is that no one told you about the cream's key ingredient, mercury. This silvery white liquid metal, which is highly poisonous, was widely used back then in certain ointments and creams to treat different sorts of skin conditions. People were happy to use it as a temporary solution because it had antibacterial properties, but they were unaware that the cost would be far higher than they had anticipated. It was even prescribed by the doctors for certain bacterial and viral infections. Too bad they didn't tell you about the side effects. Mercury is a heavy metal that can easily pass through the skin, enter the bloodstream, and accumulate in the body. Once inside, it can damage the vital organs including the brain, your kidneys, and your nervous system. Consequently, mercury poisoning started, leading to a range of symptoms like tremors, memory loss, extreme mood swings, muscle weakness, and impairment of hearing and vision. The term mercury poisoning or mercurialism was coined to describe this illness. Kidney failure, respiratory problems, and even irreversible nerve damage were among the worst-case scenarios. Eventually, it was banned in the late 1970s as more research was done and people became more aware of its dangers. Stricter rules and regulations were made for consumer safety, reminding us that sometimes quick fixes are not so quick at all. Practice 7. Smoking for weight loss and nerve relaxation. Just imagine a time when doctors would prescribe you to smoke for several issues. Was it that people were more open-minded or just not educated enough to know its harmful impacts? Believe it or not, but in the 1970s, smoking was advertised to tone down your body and calm your nerves. Well, the belief was that smoking was the leading factor of appetite suppression, which made it easy and an ideal choice to shed a few pounds. And you know what the answer is if you are experiencing stress or anxiety? Smoking. It was presented as a harmless way to relax and unwind, but people weren't aware of the killing effects of smoking just yet. Doctors were prescribing it, and athletes and celebrities were endorsing smoking, making it seem cool and an ideal way to treat your ailments. But the truth about smoking was far darker than the smoke of the cigarette. Sure, it suppressed appetite, but at the cost of several health issues, including lung cancer, heart disease, stroke, and chronic respiratory conditions, like emphysema and asthma. It undoubtedly caused you to lose weight, but it also had some long-term chronic effects. In addition, it was highly addicting. The nicotine in the cigarettes had a temporary effect on nerves, providing temporary relief from anxiety and stress. However, it became addictive, and over time, people would find themselves wanting to smoke more to achieve the same relaxing effect, putting their health and the people around them in jeopardy. Innumerable people consequently suffered from permanent illnesses, some of which resulted in early death. Nevertheless, in the late 1970s, people became more aware of the dangers of smoking with emerging research. Campaigns against smoking started, and eventually, stricter laws were put in place, and cigarette packaging had to include warnings. This change not only reduced death causes, but also opened the door to contemporary health advocacy, enabling people to make well-informed decisions regarding their health. Looking back, it is amazing to see how far we have advanced. In the 1970s, each of these practices was considered to be the standard, but we eventually got to know that they were doing more harm than good. We are very fortunate to live in a time when evidence-based practices are valued above all else, thanks to new ethical laws and regulations. From lobotomies to mercury skin treatments, let us know in the comments which medical practice surprised you the most. If you found this video interesting, hit the like button. Be sure to subscribe for more in-depth explorations of sometimes startling but fascinating aspects of history. Thanks for watching.